This episode of CP Diaries contains discussion of sexual and reproductive health and may not be suitable for all viewers. Viewer discretion is advised.
Welcome to an extra special episode of CP Diaries. Today I'm speaking with Emily and Tash from SECCA. SECCA is an interstate organisation that provides services for people with disabilities on all things related to sexual health. Welcome to the show.
Thanks for having us.
And as always, we have our telehealth nurse, Amy, along to give some advice along the way. Thanks for coming along, Amy.
Thanks for having me again, Nat.
So I think I just want to get started with a few basics for our audience at home. Can you explain the work that SECCA does?
Yeah, no problem. So we're an organisation that's been around for about 30 years. We're not-for-profit. We're not enormous. There's about 16 of us. And what we do here is we work with people and their families with disabilities and their supports as well around sexuality and relationship health. So that can cover anything within that. So we work with young people all the way up to people in their 80s. So all abilities and disabilities. We're just here to help and support through the work that we do, which includes counselling, consultancy, and other workshops that we provide and the resources we provide. So that's a very basic overview that we'll probably go into it in a bit more detail.
Yeah, there are a lot of misunderstandings when it comes to people with disabilities and their rights to sexuality. What do you think some of those issues are?
As you said, there's a lot of misunderstandings and they're multi-layered. So what we often see is that people with disability are sort of not necessarily even considered to be sexual at all. And those come from some really harmful assumptions about what it means to have a disability. And of course, we see it really differently. So we have this very sex positive, affirming approach to sexuality and rights. And of course, we know that all people have access to sexual rights and human rights, sexuality being a huge part of that. So often it is, those assumptions about people with disability that get in the way of them having their needs met, having choices, having control over how they want to explore their sexuality, how they want to engage in contraceptive choices, the kinds of relationships they want to have, all of that sort of can be impacted if they're not supported by people who recognise their sexuality. Yeah.
I just want to throw to Amy for a second. Last month we talked about preventative healthcare and the focus is kind of on and general screenings that we do. But when it comes to reproductive health, what are some of the screenings we need to be doing on a regular basis?
Yeah, it's so important. And, there's so many different aspects of sexual health, as Emily and Tash have mentioned. And I think, having that positive approach to sexual health for individuals with a disability is just so important. And, of course, you've got the screening side of things, which is a really big part of, any preventative health plan. And, we kind of touched on that a little bit last month. For women, it's around Pap tests, cervical screening. And I know, I was looking at SECCA's guide around cervical screening, and I think it's a really useful tool that I'll be using for, women that I have a chat with in our, membership community. For men, it's around prostate exams, is the big one. And, for women also breast checks. And, again, it's around accessing your GP, having a good GP, and I guess having a GP that is comfortable having the conversations around sexual health and reproductive health. We know that women with disabilities do want to have children and can have children. And, that's a really important part of any sexual health conversation is around your screening, but then also, do you want to have children now? Do you want to have children later? And I think so much of it starts with the GP.
That's our resource that we've got, which is downloadable online as well. But it's produced in easy read with all the tabs and the images as well. So that's one of the resources that we have produced here around the cervical screening. So hoping to also produce one around breast screening in a similar format. And you've just made me think of prostate screening as well.
Absolutely.
So I'll put that on the list too.
Yeah.
Over the last year, I've done a few different podcast episodes for CP Diaries on things, particularly around pregnancy. And Amy raised a really good point about, you know, women with disabilities want children and can have children in many cases. When I was speaking with some of those women and comparing notes myself and speaking to women who've had kids with disabilities, or should I say women with disabilities who've had kids, the common theme was when they went to their GPs didn't have a consistent answer in terms of whether they would need any adjustments, things like accessing things like, I guess you would call them cervical checks, things like that, things that are really hard to access. Why are these things so hard to access in the community when you have a disability?
From our perspective, which we see, you know, it comes back to that idea that, you know, the sexual needs of people with disability are rarely attended to. So it may just be neglected or forgotten or not a part of the service that's provided to them, if there's someone who's connected in with a service provider, that is. And then, yeah, so if there isn't someone who's sort of orienting them in their growing up, or they're not learning about screening needs, then of course they're not necessarily questions that people go to their GP with. So I think that's something that we definitely see. And so for a lot of our clients in the community that we work with, learning from us about cervical screening, that may be the first time that they've ever learned that's something that they can have and have a right to, which is really remarkable. Yeah.
It is. I did a breast cancer episode, and the woman I spoke with said she wasn't really aware of cervical screenings and how regular she was supposed to have them until she had breast cancer, because those two things are kind of tied into one another. And I guess the other thing, and Amy might have some ideas here, is even things like the physical act of some of these checks, the mammograms, putting your feet in the stirrups, getting on the bed. These are physical, even getting in the facility, if it doesn't have a ramp, these are physical challenges. What are some of the issues there, Amy?
Yeah, absolutely, Nat. And I think that, you know, we touched on this last episode where we spoke about, you know, right from very young children and then adults with disabilities, often the disability needs far outshadow any of their other needs. And so when the GP sees them, they might ask about, you know, the spasticity in their muscles, or, you know, the breathing problems they had, or, you know, something that's disability related, and kind of, you know, not ignore but forget, you know, the general healthcare needs that all women, men, or any gender need. And so often, you know, I think that's the one thing. It's, you know, GP education, it's parent education, you know, it's parents having this conversation with their children with disabilities like they would their children without disabilities. And then, like you mentioned, Nat, it's really around access as well. And, you know, while GP centres have gotten a lot better, you know, particularly in terms of perhaps physical access to the building, you know, there's still a lot of issues around, you know, are they able to get up onto the bed? Are they able to position themselves correctly for a mammogram? You know, the physical discomfort of a pap test might be a very different experience for a woman with a disability. You know, whether that's because of a physical sensation or, you know, sensory profile. So, you know, there's so many things to consider when it comes to adults with disabilities. And, you know, I guess that's something that, you know, SECCA's really leading the way in assisting with that, and certainly something that, you know, the conversation needs to be open and really something we all think about.
And let's be honest, cervical screenings, however necessary, are pretty unpleasant. How would you communicate and prepare someone with, say, an intellectual disability who might have trouble understanding why it's necessary, and, you know, how to get around that uncomfortable aspect?
I think that's where this brochure is not with the booklet, and there's a brochure that goes with the booklet as well. And it's really thorough because it goes through why why we have the screening. And it has all the diagrams, even to the point of, that we have this screening because people have sex as well. So, and then we've got what is cervical cancer. So there's a whole, I won't go through the whole book exactly, but then it does talk about the screening test and who should have the test. Those, because it's very specific in an easy read as well. To the point, it does talk about the different the age that you should be and how often that you should have that test. So it can be quite clearly for the carers or the support workers or whoever's the person most involved with the person with a disability. They can provide as much information as they can with this particular booklet. So it's a really what happens when you get the test. Those kinds of things. So, what you wear, it really does
everything.
Really comprehensive.
Yeah, it really covers kind of everything. I can keep going and it tells you now that now you can actually do the test yourself.
Yes.
Oh wow! See, I didn't even know that.
Yeah, so that's come into effect within the last year. Am I right?
Yeah,
with that,
So
and you can.
Self-testing is, self-collection is such a game changer when it comes to PAP tests for women with and without disabilities. I don't know exactly how it works, so I must say, but it certainly allows the woman to take the swab herself, either in the presence of a GP or not, I believe, and reduce some of that discomfort of the GP or the nurse having to actually do that test for them.
I've actually done it, Amy, and and you actually just go to the bathroom and take a swab yourself.
Right. So so that's the other thing, is it's kind of adding to that, the layer of privacy. So you're not having to undress in front of the GP. And we all know it's harder and harder to get into GPs, and especially female GPs. So if you're only able to access a male GP and that's not your choice, then that really helps.
You were showing those amazing materials just earlier. Can people access that off your website?
Yes, absolutely. So they are all available to download for free from our website.
Come in beautiful colours.
Yeah,
we
and
do.
we're very proud of them.
Yeah.
They as I said, free, and we can also send them out to you at a cost if you prefer a printed copy. It's just the cost of posting the materials. Yeah, all available.
Yeah, this gives you, this is the safer sex and STIs. So this one gives you exactly how to put a condom on. So and we're forever hoping, forever developing, aren't we? Whatever's required. So we're also hoping to get them into other languages as well. It's all about funding. But then of course we've got the sexuality rights booklet,
and I think I think that leads me to another point, which is just going deeper into the resources that SECCA can offer. I think that you provide a lot of different services, and maybe if you want to go into more detail about the workshops you offer.
Yeah, sure. So we've got 4 workshops that we've been running for quite a while now. So we run them twice a year, and they're a day workshop. So they're around the early stages of things. So there's sexuality and disability, relationships and disability, puberty and disability, and protective behaviours and disability. So there are core 4, but we've since added 2 more that are running about twice a year as well. We've Feel Safe, which is also a program that you can do on our website too, and that is like protective behaviours point 2. So that's looking at what for age groups 15 to 30. So it's looking at more that older age group protective behaviours. So that will be around online safety, the law around sexing and sexual health, and
consent,
online dating.
Yeah, online dating, more along those lines. So it's for the older the older people, pornography, that's the other thing as well. So that's one of our workshops. The other one that we launched at the end of last year is sex aids. So that's about sexual aids and assisted technology for people with disability or less mobility, less hand mobility. So Claire is our expert here, and she's running these workshops on all kinds of things that are out there that can help with pleasure. As well as educating around the health and hygiene around that as well.
Yeah, I think
we're also going to have a gender one coming up in June. So there'll be a gender identity and disability workshop as well.
I'm sure some of our members will be really appreciative of that. And this is accessible online, am I correct?
So these workshops all run here in WA. So we join you from Whadjuk, the lands of the Whadjuk people of the Noongar Nation in WA, in Boorloo. So unfortunately, they're not available online at this stage, which we would love to be able to offer that for interstate community. What we do, however, is we do provide counselling via NDIS interstate. So we can provide some more focused support for individuals who would like to explore any and all of those topics.
Yes.
And we also have on board now an occupational therapist, Alicia, who's working alongside Claire to consult around the assistive tech side of things too. So she can provide a really informed assessment and recommendations around what kinds of aids might be suitable for a person from her knowledge base, and we can provide that in an individual counselling setting. Yeah.
So just to clarify too, that our counselling sessions are for the client. So they're a one-on-one session for the client, whereas our workshops, which they're for those that are supporting the person. So they can be the support workers, the teachers, the families, the guardians, educators, psychs, OTs, speechies, anybody who's supporting them can come along to our workshops. But as Em was saying, they are in WA, hoping to do some online webinars though. So that's our next goal.
I wanted to ask just on the sexual education aspect, because I'm sure lots of parents maybe want to, approach sexual education for their children with disabilities. Do you offer any specific advice in that area, or do you find they need a different approach in terms of that?
Yeah, so I guess it's all, it is quite individual, of course, different people with different needs, different preferences. In terms of the content, however, provided it's like developmentally appropriate, and that stands for, all children, there really wouldn't be a difference in terms of the content that children we recommend they learn. And there's some really great government resources actually that are developed. What is it?
Talk Soon, Talk Often.
Talk Soon, Talk Often is a book put out by the government, and it sort of takes you through each developmental age and what to talk about with your child and what they should know in any areas of concern. And I like to map that onto our national sexuality relationships and your rights book as well, which then breaks down those topics in accessible ways for people. So we really have this idea that any information, as long as it's accessible, it can be learned and used for, to affirm a person's rights. So, we find that our clients with disabilities are some of the most educated around sexuality and relationships. They can tell us all about consent and what it is to be in a healthy relationship and all of that stuff that a lot of folks in the general population or who aren't disabled they don't have that knowledge and that competency. So the sky's the limit. It's just around, the pacing, which can be tricky. And they can be hard conversations to have, but important.
I think there's like a reluctance to talk about sex with people with disabilities, especially as they're coming up, and maybe even if they're in a position where maybe they're in a supported disability accommodation, and maybe I've had interesting conversations with some of my support workers where they think there's not much sexuality happening or not much masturbation happening. Are there inherent risks of not having clear-cut discussions around sexuality with people with disabilities, and what are they?
Yeah, absolutely. So I guess where there is a lack of information, basically we're sort of reducing a person's choices. So where people don't have an understanding of their own bodies, they aren't supported to explore their bodies, they aren't provided information around what it means to feel good, be in a healthy relationship, and then the converse as well. When they don't have that education, then there are a few reference points as they enter out into the world, meet different people, are in different settings. It doesn't put them in a position to make informed choices. And it may be that, it's not about reducing risk. It's about supporting people to make choices that are aligned with their risk appetite, essentially. So we want people to feel that if they are making decisions around whether it's, sexting, watching pornography, online dating, which we all do, and should have a right to do, that they do it with an understanding of, what that means and what their options are, what their choices are. So where people don't have access to that information, they don't have choices. And we know people with disabilities are more likely to experience violence, far more so than people without disabilities, and it's unacceptable. And the education part is a key piece to that. But I think you raised such a good point around that reluctance. And we see it both ways where people, I think it's changing in current times where people are more open to having those conversations with people with disabilities. And it needs to be boundaried at the same time. So gaining the consent of that person to have particular conversations with them, checking in around how they feel about discussing certain topics with you. Just because you're their support worker doesn't mean that they're going to want to talk about masturbation, of course. And then the opposite of that would be people who it just doesn't register. So we like to kind of have it in the middle ground where you can have those conversations and it's consensual for both people.
It sounds like, sorry, no, I was just going to say, it sounds like SECCA does some really great work with, a range of supports, like you mentioned. And certainly as a parent of 2 children with disabilities, it's really great to know that there are services that can support support workers, services, but also, people like myself, parents that, I guess as parents, we, it can be tricky enough, tricky having conversations with any of our children around sexuality. And, certainly it's something that, obviously happens at schools, but I think it's so important that it also happens at home. And, providing support to parents to do that, I think is, so important.
Yeah, we tend to try and work as much as we can as a triangular model, because what we're talking about with that client in the room every 2 weeks for 45 minutes, if they're not out there in the real world, with the supports or their families or schools on board with the same language and the same consistent education around positive relationships and sexual health, then it's not working. So we consults, we love our consults, we love our workshops, because we know that it's getting out there in the community and it's assisting everybody. And not all teenage kids want to, no matter what their ability, want to come into a counselling room and talk about masturbation. But if it's at home, if these little books are put around, flyers or anything, and they know they're being supported around that can be so much benefit. So they'll learn more. And they'll want to learn more, and they'll advocate for themselves a little bit more as well.
I think that's really good. I wanted to see, just touch on one other thing as well. In terms of exploring contraceptive options, Amy or Emily, Tash, what advice do you have there in terms of what avenues people can go down?
I think, my first advice as a nurse when I work with our members, with patients, clients, is to check in with your GP, be informed. So I think, being informed of the different options. And that's something, if somebody comes to me with information and they're looking at the different options, for a female, whether it be, the oral contraceptive pill or an IUD, Implanon, there's quite a few different options now. And, having as much information as you can around what the best option is. And of course, again, talking to your GP or, sexual health nurse at a centre, is a really great place to go, in making those decisions. But yeah, Emily and Tash, I'm wondering, is that something that you kind of work with in your consults? What are your recommendations around that?
It's on an individual basis. So I think, like anybody who is considering contraception, we would recommend that they become, as you said, Amy, informed. They, make sure they're informed. They know what contraceptions do what, for how long, what are the side effects, all of those kinds of things is important, and to ask those questions. So I would give that advice to probably anyone. If a client came into my room and said, what contraception should I use? I would say just that. You just inform yourself. This is what is out there. These are the kinds I'm happy to discuss with you and Google it and look at it and read through it with you as your support around that. But it's your decision as to what contraception you use, because it's going to affect your body in the long run. So I think that's important.
Absolutely. And it looks like there are some easy read guides on, some of the different contraception options, so certainly I think that, but like you said, working with the individual to break that down, to work out what that's going to mean for them and their body, I think is really important.
If people want to get in touch with you or learn more about your work or get some kind of advice, where can they go?
Yeah, so our website's a great place to start. It's designed aligned with our resources to be easy English and accessible. On that website, we also have a referral form. So if a person did want to look into some individual counselling, welcome to put the referral form in. And we can be in touch with you that way, and or just send an email through, in particular around training or workshops, general queries we can respond to. Yeah.
That's it. And we've got a lot of resources on our website as well, that you can access too. So not only do you can download the brochures, the Sexuality, Relationships and Your Rights, I love holding this up, don't I?
We also can provide the screenshot too, I think.
Has just been updated for the different states. So with the laws are different in each state in Australia. So each state has their own shroud.
Do you guys have an app?
Yes.
We do have
an app. I wasn't too sure. The app is not an app like you would download on your phone. It is it's an app on our website, and it is an educational tool to be used alongside the client or the family member as well. So parents can use this tool, support workers can use this tool, educators, teachers, educators. It's part of it. It's working alongside the education curriculum, and it provides lesson plans and understandings around sexual health and education. There are thousands of topics on there. You can make up your own lesson plans as well, and many, many, many images, much like those ones that I've shown you. It's the same kind of format, and it uses the correct language. So that's an app that you can explore. Everybody can have an explore of it. If they want to know more, they can contact us here at SECCA, and we can provide a little bit more education around that. And one of the updates, I think, correct me if I'm wrong, but we've just updated it, and one of them is around transitioning from school to work, which is a really it falls through the cracks. So it gets missed a lot because they're in this comfort. They're up to year 13. We have year 13 here. I'm not too sure about other states. So we have year 13. Which is the year that they can stay in ed support but learn about being in the workforce. But then still get, I know, it's pretty awesome.
I wish we had that.
Yeah, not all schools, just a few ed support schools do it, and then they go into the workforce. But there's always gaps, social gaps, emotional gaps, understanding about public and private, personal space, boundaries. So that's what we're looking at within this app as well. So we're always developing new things.
Yes.
WA are really so lucky to have you guys. It's such a shame that there's not, an equivalent in every state. Certainly I did a little bit of research, and I know that there is Sexual Health Victoria, which used to be Family Planning Victoria, from what I can tell. And, they look to have some resources, but certainly not the wealth of resources of your own. And, I guess that's, for people here in Victoria, would you suggest that they kind of got in contact with them first, or, or depending on the situation?
Yeah.
It would depend on the situation, I think, but do keep the resources that are right there in your pocket, because they're there. You can visit them. But we're more than happy to be contacted and offer whatever support we can, including sending out resources as well. So we can send this at the Australia, the different states one. We can send those out for the cost of postage. So there isn't a cost to get these resources.
We'll definitely
only postage.
For sure.
The other platform that that we offer that would be helpful for folks around Australia in that kind of post-school period is our Feel Safe, the training program that Tash mentioned. Is an e-learning platform that we've designed, which can be navigated by a person with disability and their support person. And it sort of takes you through right from how do I know when I feel safe, early warning signs, decision-making around risk, through to some of those more complex topics that we talked about before. So I would say that's a really lovely, less invasive form of input that someone might have in contact with us, that, first, if they have a look through Feel Safe and see what's there and do some learning, that can be a nice step. Because we also know that, unfortunately, people with disabilities can be really, can be over-therapized. Doesn't always happen, but meeting lots of different people all the time and expected to form these new relationships. And I guess our preference would be that if there's someone in your life who you already have an excellent rapport with, that they can be really well positioned to have these kinds of conversations with you. And that's an ongoing relationship, and in a lot of ways can be more organic for a person than meeting a therapist. So that's another option we have.
No, that's great.
These are really great resources, and again, we can't wait to see what you do in the future, and we'll be staying in touch. I can guarantee that, because I have a feeling we're going to be hearing from our members wanting to know more. Thank you so much for joining us.
A pleasure. Thank you.
Thank you.
Thank you so much.